Our beloved officers, distinguished lecturers and speakers, our esteemed members and delegates to the second PAOMPT conference, our gracious host in this year's conference, my fellow physical therapists, good morning. First and foremost, I would like to welcome y'all to today's event, the second of its kind where PTs with the same passion and manual therapy convene from around the country. It was 4 years ago, September of 2014, when I opened an email from a colleague of mine, Andre Altavas, a visionary, a leader, and a clinician. He presented the idea of how we can help and bring OMPT on the table in the country. Although there are trainings in manual therapy from organizations and individuals, we believed that there is no association that will bind us all together. Then the concept of PAOMPT was founded. The founders of PAOMPT believes that the Philippine PTs are ready to move forward. We founded an association with a mission that is to collaborate with the national and international associations in advancing OMPT practice and the standards of physical therapy in the country. In 2015, it was the year that PAOMPT Foundation was laid upon. In January of that year, the office of Dean Romel Cavazor at Veles College accepted to be our home-based headquarters. The Philippine officers were appointed. These founding officers accepted the challenge we have for the profession. In June of the same year, PAOMPT became a registered non-profit organization with the Securities and Exchange Commission. And in November of 2015, another foundation was laid upon, the Philippine Physical Therapy Association, through the office of its then president, Royson Mercado, formally recognized PAOMPT as a special interest group of PPTA on manual orthopedic physical therapy. It was a year after, that was in November 2016, that PAOMPT was officially inaugurated in Cebu City, for which I had a chance in attending its launching. Furthermore, 2017 was also momentous to PAOMPT, as we were recognized by the International Federation of Orthopedic Manipulative Physical Therapists, or IFOMT, as its registered interest group, and PAOMPT held its first national convention at UST in Manila with about 120 members. Today, PAOMPT is going strong, about 250 plus members, with 100% growth as projected. You may wonder why PAOMPT was organized. What are its missions and goals? Where does it stand on advocacy? First, our mission, as our member knows, is to advance the practice of orthopedic manual PT or OMPT practice in the Philippines in the areas of research and education, while partnering with domestic and global associations in promoting the standards of practice. In 2015 and 2017, we have partnered our national association, the PPTA, to work alongside in achieving our goals, and the International Federation to promote international standards of curriculum on OMPT. How about advancing the practice in areas of education and research? I will break this down to you with our goals. First, PAOMPT will assist in the development and update the professional and post-professional education guidelines and continuing education programs relevant to the practice of OMPT. We will collaborate with PPTA and the PRC on the development of a standardized guidelines on CPT programs relevant to OMPT. PAOMPT will recognize manual therapy continuing courses in any associations. I am inviting PPTA along with PRC, along with PAOMPT, to develop guidelines in OMPT professional and post-professional guidelines. In this way, our standards are paralleled and with the national and international ideals. Second, PAOMPT will act as a resource for the practice of OMPT in the Philippines. PAOMPT is hopeful to unite manual therapy providers, clinicians, and CPT providers. PAOMPT is a non-profit organization that only wants to unite and not to divide. We can assure everyone that PAOMPT is not a threat to established businesses in OMPT continuing education, but rather an association that will help represent us all. PAOMPT launched a recognition to courses and CPT providers. It's a recognition program. I challenge PPTA and PRC and CPD committee to work with PAOMPT in achieving unity by mutual recognition through recognition processes. Third, promote research in orthopedic or PAOMPT and facilitate evidence-based practice within members. In this year's conference, we are blessed to have a researcher who will present his work. PAOMPT will encourage members to be inquisitive, both clinicians and students alike. In next year's conference, we are hopeful that the research or abstracts presentations in OMPT grows within our members. Fourth, develop and provide mechanism for communication among orthopedic PT clinical faculty or instructors, including mentoring or CIs. Among the benefits that we promise to our members is access to evidence-based journals and mentoring. PAOMPT will regularly communicate with members and share among newest articles pertinent to OMPT. We also support mentoring and consultations with our fellows in OMPT through our closed group discussions on Facebook. I personally invite you to ask, inquire, and consult. In that way, we can provide and discuss triggering discussions and sharing of expertise. And lastly, to serve as a resource group for matters involving education of PTs in manual therapy, promoting mechanism for all musculoskeletal PT clinicians and academicians to participate PAOMPT, and promote cooperation among academic and clinicians to support state-of-the-art OMPT education at entry level, the application of evidence-based and research skills in clinical setting. During this year's conference, we are graced by the presence of one of our speakers, Dr. Carmelo Cunanan, who is currently leading the Philippine Association of Rehabilitative Sciences Schools. PAOMPT will work alongside our schools to develop a curriculum that incorporates evidence-based manual therapy. I encourage our peers in the academic field to help advance our curricular contents. PAOMPT is here to help and assist you from current trends, evidence, and even mentoring in distant learning capabilities. Our mission and goals are outlined in our bylaws. This is our guiding principles why PAOMPT was developed. Today, we celebrate our 4th year as an association. You are all witnesses. You're all part of this transformation, and I challenge each one of you to be proactive for our profession. It's time to advance. I also recognize our peers in rehabilitation medicine. I applaud Dr. Dihanyo and Dr. Durables' move for a collaborative rehabilitation practice in the country. It is time for an old practice to put into rest and a new era of independent, skilled, evidence-based practice provided by our talented PTs who are independent in making clinical decisions in both assessment and treatment planning. I also applaud the current work of the PPTA under the leadership of our President, Mr. Michael Cabilo, through working the amendment of our Practice Act, the RA 5680. This old, outdated, obsolete act should be put to rest, thus paving a new way for our clinicians to take the stance of a respected practitioner in rehabilitation. Mr. Cabilo, PAOMPT will reassure that the association will be working with our national association alongside. Let us know how we can assist. This year, our theme revolves around balancing the pillars of evidence-based practice. Healthcare service delivery models have evolved from a practitioner-centered approach towards a patient-centered ideal. Alongside, increasing emphasis has been placed on the use of pragmatic evidence in decision-making to increase clinical accountability. The way in which clinicians use experimental evidence and client preferences and clinical experience to inform decision-making provides an insight into healthcare delivery models utilized in clinical practice. The integration of clinical expertise, patient values, and the best available research evidence concerning decision-making for patients' care is a must. However, barriers are common. Why we clinicians are limited in its implementation translating to practice. Our strategies should be tailored according to their setting, and clinicians should identify these barriers. An example is a limited time identifying and interpreting research data and gap to the application of research findings to clinical practice are also reported. A study of Tilson and colleagues identified other common barriers like our inability to determine the legitimacy of research findings, deficient research literature on specific patient problems, lacking information regarding retrieval skills, and our failure to incorporate patients' preferences into decision making. Today, I am hopeful that our speakers and their expertise, we are able to identify these biases and ready to apply these back when we get back to work next week. PAOMPT can never fulfill its mission without you. You will help us transform what our founding members believed in. Lastly, I am honored to have been entrusted to lead this association since its conception, but its successes are built upon by the work of our officers. I am truly humbled to have worked with these amazing people. I am hopeful I will be seeing you all during next year's national conference. Thank you for your attention. In the meantime, welcome to the second national conference in OMPT, and hope you enjoy your stay in Dumaguete City. Thank you.